Hey class, my name is Zach Silberman. I work at Duke Regional Hospital in Durham, North Carolina. Um, so a little bit about me in my nursing career. I started nursing in 2020. I began working on the medical ICU at Big Duke, or Duke University Hospital. On the medical ICU, we were actually the designated COVID ICU, so I worked heavily with sick COVID patients from all around the region. It was a pretty interesting experience. I really enjoyed it, but I took a lot of stress home with me and kind of needed to switch things up. So in 2022, I started at Duke Regional Hospital on their vascular access team. So on this team, we're in charge of placing PICC lines and midlines and ultrasonic guided IVs. But we also respond to codes and rapids, and we're kind of responsible for all things venous access during that time. So I still get a little bit of like critical care exposure, which is nice. Um, as far as leadership roles, on the vascular access team, we do actually have a fair bit of leadership. It that we get to kind of utilize. We are working with doctors and other healthcare workers, mainly just doctors, but like we're working with infectious disease doctors, primary care doctors, and nephrologists to ensure the patient has the best line possible for what they need. Like a PICC line is going to dwell for up to a year versus a midline up to a month. And different medications need central access versus not. So all this dialogue is going on, and a lot of times the doctors are looking to us as far as what catheter is going to best serve the patient. So we kind of fill a little bit of a leadership role there, as well as we're doing consenting with the patient, education with the patient, and all of these things. So we're also helping to kind of create an atmosphere, or an educational atmosphere for the patients and the family members in regards to these lines, because a lot of times they're taking these home with them, and they want to care for those appropriately. As far as an important skill, leadership skill, I think on the vascular access team we utilize social awareness a fair bit. And so that's, going back to creating an educational atmosphere. We're also creating like a safe and confident atmosphere, because when you walk into a patient's room, they're pretty nervous. You've got a sharp object, you're looking at their arms. It's not the most fun for them. So, you try to lighten the mood and try to be socially aware of what the patient or the family member kind of needs in that moment. Sometimes they don't want anything. Sometimes they just want you to be quiet and do what you need to do. And sometimes they want you to, kind of get their mind off of the fact that you're about to poke them with something sharp. So having that social awareness, similarly, like all that team dialogue that we have, kind of letting things ebb and flow, as far as, sometimes doctors are looking directly to you and want you to make the call. And so in that time, you do feel a little bit more of a leadership role. And other times doctors want what they want, and they're going to tell you exactly what they want. And they kind of want you to kind of take a back seat and just do its asked, so long as it's within your scope. And so kind of allowing things to, come and go as far as working as a leader, but also working as a team member. It's kind of a give and take on our team. And that's kind of true too, as well as how we work. During the day shift, we've got 3 on staff. One person is considered the quote unquote charge, but we're all kind of filling our own we're all kind of helping delegate each other's tasks. And so again, it's like a give and take as far as leadership. Let's see. So I found this interesting quote. This was from an article that I found on emotional intelligence. Emotional intelligence helps to facilitate emotional well-being among APNs and helps to enhance the ability to practice competencies in a way that will benefit patients' families, colleagues, and themselves as working professionals and as individuals. Ultimately, emotional intelligence promotes much more than simple awareness of emotions. It allows for nurses to be more equipped to provide quality care and support to their patients and families and colleagues. So anyways, I just thought that was kind of interesting. And I think that emotional intelligence is really undervalued as nurses, and I think that it'll be interesting to see kind of where things go in regards to research, and also in regards to just kind of how we're treating, or not, I guess treating is the right word, but acknowledging that emotional intelligence matters, especially after kind of all the moral distress and burnout that's occurred during/after the pandemic. So anyways, I look forward to learning a lot this semester, and it is nice to meet you, class. Looking forward to more.